All right, let's talk about this. I have the brain is the final frontier, and you're supposed to be hearing that in that Star Trek voice. Remember, the final frontier. We go back to 1983, and downtown University Hospital was putting in the first MRI unit. And when it came up and we had these images come up, we saw these little white things that were on the brain, and we couldn't figure out what they were, so we called them unidentified flying objects. We just called them UFOs for the first couple years. Unbeknownst to us, what they really were telling us is it was the beginning of MS. But for the longest time, we just called them UFOs. So we've come a long way, and I put that up there because we literally have cracked open this egg, and for the first time trying to understand it. It's been 3 pounds of sitting in our head that we just don't understand how it works, and we are just now, for the first time, finally getting into the brain, tickling some little spots, and finally understanding what does it all mean. I thought this is kind of cute, because we're going to talk about the female brain and the male brain. And some of these things I really am going to talk about. Like, I'm really going to talk about why women love chocolate. And there really is a reason why we love chocolate. We're going to talk about why is that such a big section of sex in the middle of that brain, of the male brain. All right, considering that it's thought that sometimes they have as much as 200 thoughts of sex in a typical day, and a female sometimes is lucky to have 1. So you notice, it's not even in the female brain. They don't even have a lobe there. And then if you notice here too, on the power tools, see that? I wasn't able to figure that out as far as where that is, but I know my husband has it. He's got a lobe like that. Christmas time, he gets this big saw. And he's like a 12-year-old kid. I mean, he's so excited about the saw. And my daughters and I are just standing there like, what? Like, you're so excited about that? I mean, like, if somebody got me a vacuum cleaner, I'd kick him in the shins. I'd be like, but it was obviously the best present he had gotten. And we had all gotten him presents, but my son's giving him that saw. So he definitely has that lobe. Some of these other ones, like, I don't know if you can't read this one, but it says, getting lost and not admitting it. Okay, that might be a little male tendency. I think one time we were driving, and it took us an hour to go from Concord to Kirtland. And I just sat in the car not saying anything. And I'm like, I think we're lost. No, you don't say that. Okay, don't admit that. I thought Kirtland was just right around the corner, but I think it's taking us an hour to get there. I'm not sure why that's happening. Mysterious moods and behaviors of females. Can they turn on you in a heartbeat? No, you've never seen that in a wife or anything like that. You're just goofing around with her 1 second, and all of a sudden, what was with that? Well, that's going to be due to serotonin, and we'll talk about that. So we're going to get into all of this good stuff. So I'm hoping today that we discover some of the mysteries of the brain. I'm hoping that you walk out of here and I've stimulated your cerebrums. Okay, that's a good thing to stimulate your cerebrums. And I'm hoping that you can understand a little bit of the differences between the male and the female brain. I'm not going to get into too much of a review, but I do want to talk about your medulla oblongata, because you guys tickle it every day and you kind of play with it. It's responsible for our cardiac center, our respiratory center, and our vasomotor, which our vasomotor is just going to constrict our blood vessels or dilate them. You do this all unconsciously. You're not sitting there and thinking, okay, heartbeat, okay, breathe. Thank God, because we couldn't do anything else. It's also responsible for non-vital swallowing, vomiting, coughing, sneezing, hiccuping. You notice sometimes when you get something that goes down the wrong pipe, no matter what you do, you can't stop coughing. And that's your medulla oblongata saying, I'm not going to let you stop coughing until you get that particle out of your trachea. So it starts that response there. And we do this all without language. It's not a language area in this area of the brain. But what you do with it is you play with your medulla every day when you get up and you have a cup of coffee. And how many of you have to have a cup of coffee? Yeah. It's like, don't talk to me. Let me just get to the coffee. So some of you are like our first little owl up there. Maybe you don't need much. Some of you are like decaf, which you can see what he looks like with a little bit of decaf. What you're actually doing when you had that cup of coffee, you are suppressing a neurotransmitter. Adenosine is a neurotransmitter that we love at night because that takes neural activity and actually slows it down, and it says, let's get ready for sleep. Okay, let's slow down neural activity. When you take in caffeine, you block it, and you also release dopamine. And we're going to talk about dopamine because we love our dopamine. Just love dopamine. So it's going to release a little bit of dopamine, and then what it does to your medulla is it says to your medulla oblongata, take this and let's increase heart rate and let's increase respiratory rate. So now you're beating a little faster and you're increasing it. Now you have that second cup of coffee. Now you have the third. Maybe you're like me and didn't understand what espresso was and had one late at night, so I look like that owl at 2 in the morning. Okay? So, and ever had it where you've taken too much caffeine and all of a sudden you're like, okay, let me run the halls. like that, because you've taken too much. You've raised your respiratory rate too high, your heart's too high. And some of these energy drinks, I don't know if you've seen some of these kids drinking them, but we're a little bit concerned with them because we've actually had some people go in AFib with it because they've raised their heart rates too fast, too high, and so they can be dangerous because we're not even sure sometimes of the levels of caffeine. It depends on what research you're doing. Some sources say 77 cups, some say 113 cups of coffee would actually be toxic and would actually kill you. But we don't know what these kids are drinking, and I don't know if you ever read some of those energy drinks. I'm not even sure what's in some of them. Do you ever read some of those chemicals? I'm like, what is that? I don't even know what that is. So we're not really sure. On an average, 400 milligrams a day is about enough, which is about 3 cups. Coffee's had a bad time and a good time. Right now it's a good time. Everybody's loving coffee, so we'll see 10 years from now where we're at. The PONS is just going to act like a bridge. Your midbrain is going to be regulate your auditory and visuals. Your thymus is also going to relay this, but I'm going to talk about this. I want you to notice that it's with the exception of smell, and we're going to talk about smell because what we underestimate, we think of smell, we think of a bloodhound. We kind of underestimate the power of smell with humans, and I'm going to get into an example of that later on. Love the hypothalamus. It's an amazing little guy. He talks to the pituitary, regulates heart rate, contraction of bladder, produces ADH. Now you're wondering, why does she have a green beer up there? Well, we just had St. Patrick's Day. And St. Patrick's Day, some people might have consumed a lot of green beer. I don't know who they were, I don't know, but there might have been people out there that consumed some green beer. Well, beer in itself has alcohol, which inhibits ADH, and ADH is an antidiuretic hormone. So if you get it, it's antidiuretic, so it makes us retain fluid. But now if you inhibit it, you're going to produce a lot of fluid or water in your urine. Now you combine that with the fact that beer is a natural diuretic, which actually in some people with kidney functions, we actually recommend a beer. We don't recommend a 6-pack, but we'll recommend a beer. So on Friday, St. Patrick's Day, there might have been a lot of people inhibiting their ADH and also taking a diuretic at the same time, which is why downtown looked the way it did. Oxytocin, that's our cuddle. Our cuddle one. They call it sometimes the love hormone, the cuddle hormone. It's the one that if you have your significant other, you crawl into bed and you spoon each other and you hug each other like that, and you just do this big, and then you're like, I'm hot, get out here. Back up, okay, back, like that, okay. I just needed a little oxytocin there, and that's all I wanted. Now get back up to your side of the bed. It controls our body temperature, our center for mind over phenomenon, our hunger and our thirst. Many people go on a diet and they say, oh, my stomach shrunk. Well, stomachs don't really shrink, but what we do is we actually retrain our hypothalamus to recognize that we're satisfied at an early stage. Mine's a little malfunctioned though, because I can eat an awful lot before that thing tells me that I'm satisfied, especially on Thanksgiving. So I got to work on that one. Our lobes of our brain work on all kinds of fun things here, and I don't think that's too small for you to actually read. But like our prefrontal lobe and our frontal lobe is going to be used for thinking and planning and problem solving. One of the things kind of interesting that babies that are born to mothers that are using crack, cocaine, heroin, or meth, it messes up and they don't develop what's known as a prefrontal lobe, and it actually causes the development to decrease in the prefrontal lobe. Now our prefrontal lobe is sometimes called the executive function area. It actually tells us our moral behaviors and what to do, what decisions to make, and without it, as a result of these babies growing up, they don't develop that, which is why it's estimated that as much as 60% of them will see the inside of a prison, because they just don't understand that you can't, what's the right and wrong of it. And we're also finding out that a lot of these babies that are born to mothers that are addicted, we're finding that other areas of the brains are also not developing, and studies are coming out even further about the long-term consequence of these babies' brains being developed in an environment of drugs. Your occipital is going to be your vision. We had one case where the young girl had lost her vision when she was 2, and she felt when she's in her 20s now, and she falls off the back of a couch and hits the back of her head and regained her vision. She was engaged at the time, and they asked her, since she'd regained her vision, what was the most beautiful thing that she had seen since she'd regained her vision. And she says it was the face of her seeing eye dog. Isn't that neat? But notice she didn't say her fiance. I mean, think about that. You gain your sight, and all of a sudden you're like, ew. Oh my God, I thought you looked like Brad Pitt or something. And you're like, good God. You know what I mean? In your mind, you would have had something. But she played it safe and just said the seeing eye dog. Our parietal lobe, I'm going to talk about that. So that's perception, classification, spelling. I think ever since we've had spell check, mine's atrophied, though. Ever notice that since you have spell check now? I mean, sometimes it's the simplest word, and I'm like, just spell check it. I'll just type in halfway and then it'll correct itself. Although it does correct itself sometimes in strange ways. Temporal is going to be used for memory and understanding, language. We have a lot of language areas now. We didn't think that, but now we realize we have many more language areas. And then your brainstem is down there. Limbic system, oh my gosh, does that rule us? Our limbic system, you want to think of it as your emotional part of your brain. It's where you have aggression, you have anger, pleasure, rage, fear, sorrow, sexual feelings, and affection. It's hard for you to tell, but on this, I'm going to talk about the amygdala and the hippocampus, which is all part of this limbic system. Now, what is brain mapping? Because this is how we're able to find this out. We're going in and we're tickling people's brains and we're doing different things to them and finding out where are these centers. And we're finding out that where mine are not where yours are. And the reason being is that, like, I'm not have any music in my life ever. I mean, I couldn't play an instrument if my life depended on it. I couldn't sing. I couldn't do anything. The musical part of my brain fell out of my ear a long time ago, atrophied and fell out. But that meant that somewhere else I probably am stronger. So when you were to go and do some brain mapping on me, and you were to do brain mapping on somebody that's very musical, we're going to find out that we're not exactly maybe in the same spot. Does that make sense? So on what you're looking at here, on the left is an MRI, and on the right is a PET image. Now, an MRI, what we do when we put you in an MRI is we're really putting you in a big magnet. But it's not like your refrigerator magnet. This is basically a coil of wire that we have electricity going around and we generate a magnetic field. When we put you in there, we line up all your hydrogen molecules automatically. Like, you don't feel it. It's not like all of a sudden you feel anything like that. But then we knock those hydrogen molecules around. And basically, they're going to send back a signal. So if you've had an MRI, you might have noticed that you maybe had to put your head into this kind of apparatus. We call it a coil. It's basically like a big antenna that when the hydrogen atoms that we knocked out of alignment come back, they're going to send a signal. That antenna is going to pick it up and give us real good resolution so we can see what's happening. So let's say on that MRI, I have on there all that nice brain matter on there, but there's a tumor in it. Maybe the tumor is going to send back a signal a little slower, and then the computer is going to say, well, make that a different shade of gray, because it came back at a different time. And that's why we're putting all those funny things on you. If you've had a shoulder MRI, you might have had this funny round thing that they stuck on your shoulder. You might have had to stick your knee in something. They're big antennas are what they are. And then we just kind of bounce your atoms around and pick up the signals and make an image out of it. The interesting thing about an MRI is that bone does not show up. Okay, bone doesn't have enough hydrogen in it to show up. So that's why we see such soft tissue so nicely on an MRI. Bone imaging would be done with a CT scan. So what's the use of it? Well, we can diagnose disease, so we can see a lot of different disease processes. We can prepare people for surgery ahead of time, knowing what's going on. We can test for psychological disorders. We know now schizophrenics uptake glucose abnormally, not in the way that a normal brain does. We know we can check your thoughts, this is the fun part. We're going to check your thoughts. And then we're going to see some differences in the brain. We've actually done it where we have people just tapping with their right hand, and we can see where that is in the brain. Then they tap with their left hand, and we see where that is in the brain. So we can tell the differences between right-handed versus left-handed. And then we'll get into talking about male versus female. So one of the ways we do it is with functional MRI. Now, functional MRI uses a thing called the Bold effect. And this is what's known as blood oxygenation level dependent. Where you have activation in the brain, you're obviously going to take up more oxygen. So what we do is we're going to pick that up on a functional MRI scan. So in this one, what you're seeing up there is they took a scan of the patient and they were looking at nothing. Then they had them look at a complex picture. And if you take a look, that bright orange area is the visual cortex, and that's exactly what lit up. So they had to look at this complex picture. They're asking them questions about it. Not that we can really move in an MRI, but they're having them look, and then we see all this activity increases on the functional MRI. Here, what we have is that's the MRI unit. Have you been in an MRI unit? Was it fun? No. Okay. We have all kinds, though. We've got some that you might have been in one that has what's known as a long bore. Kind of felt a little bit like a coffin, maybe. People, claustrophobics don't like it at all because they're in there. We've done everything to try and relieve that. We blow air through it, which sometimes we freeze you then. As a result, they might wrap you up in a blanket because there was so much air, because a lot of claustrophobics can't feel like they can't get air. Now we put a head coil over you. We were putting this 90-year-old man in a magnet one time, and the table wouldn't index, which in other words, we couldn't move it out. So he literally had to get in there and crawl. So he's crawling in there. Then we had to have him roll over onto his back and then stick his head in the head coil. So 20 minutes later, we finally have him in the magnet, And we go to walk out, we all go back into that room out there, and we walk out, and we look back in the room, and he's gone. And they're like, where'd he go? And all of a sudden, we hear a voice behind us. He goes, I'm right here. And we're like, that man got out of that magnet so fast. It took us 20 minutes to get him in. It took him 2 seconds to get out of that magnet. And there he was standing behind us. He goes, I'm not going in there. Like that. Nope, couldn't do it. So it's not uncommon for us to see people with claustrophobic problems with MRI, as well as there's a big safety issue with metal. We have to always watch for ferromagnetic material. So if they're asking you a long list of questions, our MRI safety book now is about that thick for material that we have to check for before you go into an MRI. So, and that's because we've had safety issues with them, because they're powerful magnets. The magnets are done in what's known as Tesla, which is a unit of magnetism. Our smaller ones are like 1.0 and 1.5 Teslas, but we're up to 3 Teslas and 7 Teslas. The Cleveland Clinic just put a 7 Tesla in, which is a powerful, powerful magnet. It can pull up a whole hospital cart up against it. We've had one that pulled up a whole tow motor up against it. That's how powerful these magnets are. So we really are checking you guys thoroughly before we go through this. There are open MRIs, though. So the open MRIs are just that. The sides are open, so you don't feel so claustrophobic. So if you really do need an MRI and you need to go, just call ahead and find out if it's an open MRI, because it's kind of looks like a bagel, like your little cream cheese in between a bagel. So PET imaging is another way that we've seen this. I remember we had a major breakthrough. When PET started off, it was referred to as the black hole, because financially it was draining these institutions because there was no dollars to substantiate it. And one of the first people to help substantiate it and help us get dollars was Philip Morris. Okay, and the reason being is that Philip Morris, there was talk at one time that they thought maybe smoking might prevent Alzheimer's. So who wouldn't want to back that up but Philip Morris? So they actually came to the rescue to hospitals and granting some grant dollars so we could keep up with PET. And what happens with PET is that we inject you, or you inhale, a radioisotope that we put a tag on it. And by a tag, I mean that it's going to be a substance that maybe we'll inject it and maybe only your skeletal system will absorb it. That's the kind of tag we put on it. Or we'll put another tag on it that when you breathe it in, only your lungs will absorb it. And wherever you've got a lot of biochemical activity occurring, the radioisotopes will go there and light up. What you're seeing up here is a normal brain to the left. Then you're seeing one with early Alzheimer's, and then you're seeing one with advanced. And you can see how the brain's cooling down. All right, I remember it was a major breakthrough. Then we saw a PET image that we could see Alzheimer's on it before the patient was symptomatic. And for us, that was like the spread in Playboy. We were all excited about the image. My husband said, that's just so sad. We were all excited about that image. But think about what a breakthrough that is. So what we look for is that hot spots. It's a lot of activity. Maybe we can check you. Let's say we're not sure if you have cancer anywhere in your body, but we can maybe take you into a PET, inject an isotope, and wherever there's a lot of mitotic cell division, that radioisotope is going to absorb it, and we see what we call hot spots. And we'll see a hot spot maybe in the middle of your femur. Now, it doesn't necessarily mean it's cancer, but what we've got there is a lot of activity. So we've got to investigate that. Or we follow up with people. Maybe they've been in remission for years, but now they have a slight cough. Maybe we could do a PET and make sure that the lung cancer is not back, kind of thing. And it just is a matter of you're still in a device that kind of looks like a CT scanner when you go in. You inject it, and then sometimes it does take a while, so they'll tell you to go have lunch because you have to absorb it all, and then we'll do the image. But these are major breakthroughs that we've had. Like this one, this should be an orange circle all the way around, but I don't know can you see, I don't know, right there? All right, that's an area that's cooled off, and this was a brain tumor. So the brain tumor, and we should see a nice full circle. Instead, we see that. But the nuclear medical area, we still kind of call it the fuzzy sciences, because that doesn't tell us too much detail. So what we've been able to do now is we do what's called fusion, and we fuse a PET image with a CT image. CT can tell us very anatomical detail, and we put the two together, and now we can see exactly what's happening with that patient. We're fusing also with MRI. So why is brain mapping vital to medical and the psychiatric fields? Well, this are 4 scans up here. The one in the upper left is a normal brain. And what you're seeing is what's known as the reward center of the brain. So what we would like to see is a lot of red. So that normal brain's got a lot of red in it. If you take a look at the next one, that's an obese person. So do we see it? Matter of fact, you're not seeing any red in that. The one to the lower left over here, oops. This is a cocaine, no red, and this is an alcoholic. And this is responding to dopamine. Dopamine is a neurotransmitter that stimulates our pleasure center. We really are ruled by it for the most part, although recent research is finding out that dopamine does a lot more than just that. But dopamine, you've gone to Cheesecake Factory, let's say, and you're there, and we have to check all those cheesecakes out. We got to study them, okay? And you studied them all, and then you finally pick the one you want. You sit down, you've got it, and if you ever do this, just for just a second, you're just like, got it, like that. You're getting dopamine. You love that dopamine. And then you start to eat, and dopamine's all over the place, and you're just like, your limbic system is all lit up, and you're a happy camper. And then it's gone. And now you're like, oh God, I ate the whole thing, And then you're like, I can feel it growing on my butt now. So we love dopamine. So we love it so much that here's what happens when you're in love. And this is a lecture that I've given all 4 of my kids. I think from the time that they were teenagers, they knew about this lecture, and I would go in great detail. What happens when you fall in love, literally the person's lighting up your life. You get a chemical cocktail of dopamine. On top of that, you get oxytocin, which is the cuddle drug. You get vasopressin, which is, again, ADH. And all of this is amplified by a thing called PEA. And PEA actually is a neurotransmitter that takes all the other ones and takes it up a notch. All right? Now, everybody's had a friend like this. They've fallen in love. And you're like, oh, yeah, I can hardly wait to meet them, like that. And then you meet them, and you're like, oh, whoa, here. You're like, oh, we got to talk to her, like that. So you're talking to her, and you're like, you didn't notice all the teeth that were missing? Like that. And she goes, oh, no, I love him, like that. And you're like, well, what's that thing on the end of his nose? Like that. And you're like, oh, I love him, he's beautiful, he's so handsome, like that. And you're like, yeah, he hasn't worked for like 10 years. You don't have an issue with that? Like, no, I love him, he's just the best, like that. Oh yeah, she's in PEA and everything else, And this is my kids, when they were growing up, I was like, when they'd first meet somebody, you know how you can tell, like, they're like, uh-oh, they're in PEA. Like they're, and my kids are the only ones when my son would meet somebody, all his sisters would go, PEA, like that. And who does that? I mean, our whole family does it, PEA, like that. Well, it was actually meant for us to make sure that we procreate. So that toothless wonder that's unemployed, yeah, that's what it was really meant for. It lasts on an average of about 3 to 6 months, that high, and then it's going to drop off. You might know somebody, though, that gets addicted to this. Do you ever know somebody that had that girlfriend that was like, I'm in love. You're like, again? What? Like, what now? Who is it now? Like that. And you're like, oh, I love him. And then all of a sudden, they're like, just wait 9 months. Just wait 9 months, because we got to get an endorphin release here coming up here. And all of a sudden, they're like, ew, something doesn't feel right. Well, they lost their PEA. They lost all their dopamine. And that's when all of a sudden you're like, whoa, he doesn't have any teeth. What happened? I mean, like, I didn't know he had any teeth. And what is that thing on the end of his nose? So I'm always telling my kids, like, let it calm down, no wedding, nothing, let's not do anything, okay, PEA. So we worry, this is all affecting all the reward system, your emotions, your motivation. To some extent, they say it can act like morphine on the brain, if you think about it. So think about it, you can't eat, you can't sleep, you're suddenly getting skinny. What's with that, And it's gonna act on this thing called, I'll get into the ventral striatum in a minute. So we've actually found the areas we've actually found that when people are in love, these areas can light up. When you've fallen out of love or never been in love, that's what we see, those areas light up. And the interesting thing, they just did it out of University of New York. It's a neuroscientist that did this study, and she had people come in that had just fallen in love. And we see these areas light up. But they also did it on people that have been in love with their partner for years to see, did they really light up? And sure enough, they lit up. So it's kind of neat. They still light up. So those don't get tired. Okay, so here's what we've been waiting for, that male brain thing going on here. Things like the major parts of the brain, the medulla oblongata, all these things, they're not going to be any different in male and female brain. These are subtle differences that we're finding out. And we know those subtle differences. Like my husband with the power tool. It's just like, we just stared at him like he'd lost his mind. He was just like, he was so happy with that. The rest of us, we just didn't get it. So one of the things about the male brain is usually they judge speed a little better. They can carry out mathematical calculations. They can orient in space a little better. Visualize objects in 3 dimensions. We were finishing our basement, and my husband was telling me, yeah, the bedroom will be here, and the living room's going to be here, and we'll put a little bar here in the bathroom. And I'm like, really? That looks like that's going to be really little. And he's like, no, no, it'll be a good-sized bedroom and like that. And I go, oh, no, I think you ought to make it bigger, like that. And he's like, no, I know what I'm doing. Like here, I'm like, nah, you ought to, like I think that bar is only getting like 2 people behind it. I go, let's put it out to here. And he goes, well, that would get 14 people behind it, like that. And I'm like, so after a while, I just gave up. He kept going over these plans, and I just couldn't see him. I couldn't see him at all. I was just like, and he could. He somehow could visualize that, everything he was talking about. I was like, I have no idea what you're talking about. Just do it, okay? You might have known that men are a little more dominant and have a tendency to be a little more aggressive. That might be news to you, newsflash. Women, we're good on human relations, recognizing, oh, you've had this one, the emotional overtones. I know what you really meant. That poor husband sitting there going, I thought I really meant that. And you're like, no, no, I know what you really meant when you said that. Because we know those emotional overtones. Language, we're much better at language. Artistic expression, aesthetic appreciation, and carrying out detailed and pre-planned tasks. Now, as much as we like to think that we've advanced, we're still only using about 20% of our brain, and it's still kind of like a caveman mentality. We really are still at that level. And we still are primal in very much our instincts and how we respond to things. So I've got the caveman up there kind of showing you that we haven't deviated a whole lot from that. We still have a lot of our brain that's not being used. So what's happening in the male brain? Well, the male brain has an inferior parietal lobe, particularly on the left, that's larger. And that's kind of our math area of the brain. On that left inferior parietal lobe, they can do time, speed, rotate, 3-dimensional. This is my husband. He could tell that whole basement thing and how to do it. And I was like, huh? Couldn't get it. You know, left inferior parietal lobe is atrophied. So this is why sometimes some of our mathematical genius, Einstein, when he died, the coroner that was, he wanted to be cremated. And the coroner just couldn't do it. So he stole his brain. So we have his brain, and we've been studying his brain. And one of the things that we realized about his brain is that that left inferior parietal lobe was larger, but he also related more to the right side of your brain. The right side of your brain, you're more creative. Okay, so think about it. You're mathematical genius, and you've got creativity. What better cocktail is that to make a genius? And we're still studying his brain right now to this day. The amygdala, which is that part of that limbic system that I talked about, is larger in males, which, you know, if you remember, that was what aggression. Okay, that was that aggression area. So let's go back to caveman and let's think about this. Women aren't so much. So now we've got a caveman that's out there in the wild, and here comes a tiger. All right, and the male's looking at this thinking, kill it, kill the tiger. You know, women, I don't know how to explain this. We're like, I don't know. Does it look hungry? Like its fur, like that. We're just standing there and we're going to be eaten. Okay, so there's a reason why that amygdala is bigger in the hunter. Go back to caveman. He was the hunter. All right, and he's going to protect us. He's going to be the wild animal. He'll be controlled by the prefrontal cortex and pulled back by that. But if necessary, that amygdala is going to go crazy and be the hunter. While the women, we're back in the cave moving the rocks around. Okay, making it aesthetically a nice cave. Okay, because we'd be eaten out in the wild. Does that make sense? So that's why there's a reason why they were dominant and why there's aggression and why that amygdala is bigger in males. Brain trauma, I just threw this in here. One of the things that's kind of interesting about the brain too, and we're talking a lot of studies now about TBIs, which are traumatic brain injuries, which ever since Iraq and Iran, our soldiers are coming back with all these injuries and concussions and stuff. A lot of studies have come out. This one, I'm not sure if you've ever heard of it. It's called acquired Savoy syndrome. And this is when a person has sustained brain trauma, and what they've done as a result of the brain trauma, they later have turned into a prodigy in an area. So they had a 42-year-old male that was in a car accident, and he sustained a pretty good head trauma, and he gets out of the hospital and he goes home and he notices that when he's looking at the water in his sink, somehow the water is not looking the way it used to. And later on, he turns into a math prodigy. Then they had another gentleman that never played the piano in his life, sustained a severe brain trauma, and eventually ends up being a prodigy and playing the piano. And there's 40 documented cases of this, where people have sustained brain trauma and then turned into a prodigy afterwards in a certain area of the brain. Now, I've hit my head, none of that has ever happened to me. Okay, no, I think I lost something when I hit it. I didn't, nothing. What's bigger in the female brain? Female brain, the anterior cingulate cortex makes decisions and weighs out things and weighs them out again, weighs them out again. So they kind of call it a little bit of the worrywart center. And of course, we've got a bigger one, you know, and we've all, you know, we all have gotten that where we worry, 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 worry. Prefrontal cortex keeps the amygdala in control. and keeps our emotions in control. So while that amygdala is going crazy with the guy, what are we saying? Calm down. Calm down. How many times do we say that? Get your amygdala in control. You know, I'm the only person at home. I tell my husband, get your amygdala in control, okay? It's getting out of a little control here, because mine is always doing that. But the interesting thing about this is that it grows faster in teens, in girls. So think about emotions, control, girls. What do we always say? Don't we always say they mature at a faster rate? And it's about a 2-year difference. Your hippocampus, I love to mess with my husband's hippocampus. That's memory. Okay, that's associated with your memory. It's larger in women, so what does women, you know, what do we do? Do you remember August 16th, 2014, you said to me, and that poor husband's like, I don't even remember what I had for lunch yesterday. And you remember August 14th? I mean, like, what? Like that, and they're taken off guard. Well, yeah, because we have a bigger hippocampus, and we don't ever forget. Okay, and we remember it was at 3:30, and you sat there, and you said to me, like that. And then my husband says to me, that's your hippocampus. I love to mess with his, because what he does, he falls for this every time. He's going to the store, and I'll say, can you get some milk and bread? And he'll go, oh, yeah, okay, no problem. Then all of a sudden, I throw the third item in there. I'm like, can you get eggs too? And all of a sudden he's like, okay, I need a note, I need a piece of paper, like that. Now we've lived in the house for years, and the paper and the pen is always in the same place, but I've thrown his hippocampus into like overload. I've given him the third item that he has to get. So now he's like, he does this little thing where he like doesn't know where he's at for a second. And then he goes and he finally finds the paper, which has been the same place for the last 14 years. And he writes it down. And when he was growing up, he went to Catholic schools, and those nuns must have just beat him. Because whenever he goes to write cursive, he always does this little thing where he's like, I'm like, you poor thing. He was left-handed. So they were like, you know, they were trying to, so he always gets ready, and he's going to write his cursive, and he like poses almost, I'm going to write my cursive now. And he'll write, and all of a sudden he'll go, wait, what was that I have to get? I'm like, eggs. And I'll be like, okay. And then he goes to the store and he comes back, and guess what he doesn't come back with? Eggs, yeah. Yet he had his little note and everything else. Hippocampus. And I mess with him all the time. I could have 2 dozen eggs in the refrigerator. And I'll be like, yeah, get eggs. Like that. Like that. Just love it. And I do it to him every time. I'm always like, and he'll go, okay. Then I throw that third object in there. Oh, get some water. Yeah. This one's kind of cute too. Women process verbal language with both hemispheres, and particularly of the frontal brain. So when somebody's talking to us, we're using both halves of our brain and we're listening. Men only listen with the left side. What a surprise. The right side of the brain actually cools down in activity, which is kind of crazy. You ever notice that when they're listening, they don't make eye contact? And you're like, hello, right here, right here. Okay, part of it is they're looking down because they only have one half of the brain to listen with. So they got to shut these senses down so they can listen with this one little half of their brain. So they'll shut down. They're not looking at you. And we don't like that as women. We're like, hello, right here. Right here. What are you looking at? Right here. Like that. And they're looking at the floor. I noticed that my male students do that. A lot of times I'll be lecturing, and they won't look at me. They're looking at the floor. And now I know why. They're trying to listen to me with that little half of the left brain that they're trying to listen. But here's the exception, though, and amazing. If they were raised with a pictographic language, they'd listen with both hemispheres. So Fred was listening to us all those years. Right? He was actually listening to us. This is an interesting study that they did. This was women who had a condition called congenital adrenal hyperplasia. And they were actually secreting male hormones when they were pregnant. And so there's a lot of testosterone that's being produced. As the embryo is developing in a testosterone-based environment. And what we found out is as the women grew up, they had a tendency to be attracted to male-dominated professions, such as architect, engineering, something like that, construction and stuff. So like where is the influence? We do know that this guy has to do something with that embryonic development and what are they bathed in. It's a fascinating study. Decision making. This is kind of crazy, and I'm always, when men make decisions, I'm going back to my caveman, and here comes the tiger. They make their decision fast. Okay, we got to kill the tiger, it's going to eat us. Okay, women, and when they go and we did some functional MRI studies, we found out that the male's activity level goes from 1, 2, maybe 3 places, and then they make a decision. Women, we have a tendency to go to one place, 2 place, 3 place, revisit. We'll go back and revisit sometimes the place and then come back again to make the decision. So we're a little slower at making decisions. So we've been eaten by the tiger. But at the same token, it's thought that we make long-term decisions a little better because of that revisit. Because we took knowledge that we learned from the first 2 places, revisited back to that place, and now took it with us to another place. Does that make sense? But we are kind of difficult at making decisions. So if you look at it, my husband one time said to me, he goes, I'll wait out here in the car while you go get a dress. I was like, what? I go, yeah, just go get a dress and I'll wait out in the car. You're going to sit out there the whole time? He goes, how long could it take? I go, what? Like that. I go, you go home and finish the basement and then come back and get me. I go, I'll be done then, you know? If you look at the way we have to make decisions, if you look at even Great Lakes Mall, what do they have? They have Dillard's that's one whole store dedicated to nothing but women. And then you go to the other store, and even the upper half of it is home goods, and the men get that one little lower half. Okay? And they go in, they have a brown suit, they have a black suit, so they go get a navy blue suit. You know, no big decision. We have to go to one place, try a dress on, go back over here and try a dress on, go over here. We got to feel the texture of it, got to look on how it looks on our butt, all this other stuff. Then we go back, maybe visit again, try that other dress back on, right? And then we go over here. And then we finally make the decision, and my husband has the entire basement done by that time. Okay? Because that's how our mind works. But if you look at primal man, let's go back to caveman again, we were meant to have the hunter and have the gatherer. So it meant that we'd stay at home. Serotonin levels are released in the female brain at much higher rates, which explains our mood swings. Serotonin is responsible for some depression in our mood swings. They're much lower in the male brain. Okay, which is understanding why all of a sudden 1 minute we're one way and another minute we can be another. So we revisit all these different areas of the brain. We go back and forth before we finally make that final decision. This is excellent. Remember I told you about your sense of smell, and the sense of smell has an olfactory bulb that goes right to the limbic system. It's one of the few senses that do. Up here in your nasal area, you have your olfactory nerves sitting in your ethmoid bone. So when you sniff something, you're taking in more of the scent. It centers all over those olfactory nerves. Then we interpret it. But the thing about it is it also goes to the limbic system, that emotion. And everybody's had that, where you walk in grandma's house on Thanksgiving and you're just like, yeah, that's good. Or maybe you smell something from your childhood. You know, and you're just like, oh, that smells like my childhood or something like that. Do you ever notice that smell stimulates your emotions so much? When my mom passed away, one of the things that my dad brought over was one of her purses. And it had been about a year or two since she passed away, but I opened it up and it still had the scent of her perfume in it. And it immediately brought me almost to tears because I couldn't believe I could still smell my mom. Do you know what I mean? And just the immediate response that brought to me. So we're very, very much, a sense of smell is much more important than we ever thought before. People can actually get in car accidents and have this bone come back and shear off their sense of olfactory nerves. And think about that, because you really lose a lot of taste when that happens, because you don't smell it anymore. I had one of my students that's exactly what happened. She was in a car accident. She went forward and hit the steering column right here, and it actually ended up eventually cutting off her olfactory nerves. And I asked her, I says, when you eat, like what's it like? And she says, oh, I just eat to survive. You know, just my stomach's hungry and I just eat. I go, I don't need to season anything. I go, do you buy perfume? She goes, I let my boyfriend pick it out because she can't smell it. So she lets him pick out whatever he likes. So it's a very powerful thing. The interesting thing about males have a tendency to respond to the smell of cinnamon buns or pumpkin pie, and that actually arouses them and it stimulates their limbic system. Also, this is kind of odd, the smell of licorice and donuts. I don't know who does these studies. When people go around, they sniff all this stuff. Women, we respond to a drop of male sweat on our upper lip. Yeah, that's what we respond to. The female brain, we got to work on this, girls. You know, because there they are smelling cinnamon and stuff like that, and they're getting all excited, and we want a male sweat. So what was that all about? What's with the male sweat on the upper lip? Well, that leads us to dirty T-shirts and your amygdala. They did this study, and they've done quite a few of them now since I've studied this, where the one I just saw the other day was they had a bunch of women wear 100% white cotton T-shirts to bed, no deodorant on whatsoever, and they had them wear it to bed for a couple, days. And then in the meantime, they'd done a genetic workup on these women and a genetic workup on the man that's going to smell them. And what you didn't want is you did not want them to match genes. You wanted them to have opposite genes. That way they would have a superior offspring that would have a good immune system and things like that. So they wore these T-shirts, then they took them and they put them in jars, and they put foil over them, and they had all these jars there, and then they had the gentleman sit down who they'd done the genetic workup on, and he was to smell them and then rate them based on which one smelled good to him and which one smelled very bad to him. And what you wanted is you wanted them to not have genes matching. Okay, so that way they would have superior offspring. And all he's doing is basically sniffing stinky T-shirts. So that's what they're going to call it, the stinky T-shirt research. So what he did is they would cut an opening in the foil, and he'd sniff in it, and he would rate them. And he rated them based on the one that he found the most appealing to the one that he found the least appealing. And what they found out that the one that he found the most appealing, they had no matching genes. They would have superior offspring. And the one that he found that was the least appealing, they had 4 out of the same common genes and would have had offspring that would have had some defects. Isn't that amazing? So you ever had somebody like this where they're like, I don't know, there was just no chemistry. Like, you know, like, or somebody like, you two would be perfect together. And you're just like, he smells funny. You know what I mean? You think about it? I mean, whether we know it or not, that nose might be telling us a lot more than what we really know. I mean, and we've all had that. We've met somebody and everybody's like, oh God, you guys make such a cute couple, like that. And you're like, nah. Think about it. Maybe that nose is a little more powerful than we think. I'm a big believer in aromatherapy. I really think aromatherapy is very good for us and stimulating. Like peppermint essential oil is very invigorating. Okay, chocolate cash and cocaine and a beautiful face. What has that got to do with anything? Well, they all release dopamine. We have a reward circuitry. There's actually 2 major pathways that occurs, one eventually going to our frontal lobe, thank God, because that's where we got morals and stuff like that. But we love chocolate. The reason we love chocolate is because we get a little dopamine. At one time it was thought that it had PEA in it, but it doesn't, but we like to think it does. So it makes us happy. Cash. How many people have done this? You've gone out and you bought scratchers, maybe bought $10 worth of scratchers, and you're like, I won $2. And you're all excited. It cost you $10 to get the $2. That's not crossing in your cerebrum at all. Okay? You're excited because you won something. Why? Because you got a little dopamine. Why do people like scratchers? Because it's dopamine. Why do they like to gamble? Dopamine. You know, some of these people, like, they guard their slot machine. They actually guard it. Like, you know, like they look around, make sure nobody's around, sneak to the bathroom real fast, come back, because that's their slot machine, because they're getting dopamine that whole time. Cocaine does the same thing. Now, here's the problem with our cocaine, our heroin problem that we have now in our meth. That first hit that they ever take releases dopamines all over the brain. And I mean, it's like the euphoric high of anything they've ever had in their life. Then now they start to chase the dragon because they want it again. Well, the problem is that the brain adapts. And when the brain adapts, they can't get that same kind of high that they had that first time. So what do? You got to use a little more, a little more, a little more. And then look what's happening with our heroin crisis, because they have to use a little more. It happens with meth. It happens with cocaine. It happens with heroin, with all of those. What are they getting? They're getting this huge euphoric dopamine all over their brain. Every time they got to go a little bit more, a little bit more. So this is all part of this ventral striatum reward circuitry that's happening. And it rewards, sometimes it does come up to the frontal lobe, thank God, it gives us a little common sense. But all of this, a beautiful face, like when you see an advertisement, you don't think marketers are onto this? Oh my God, are they onto it? They are onto it so much that they actually have done studies. Marketing companies are sponsoring the studies to study your reward circuitry to see which commercial you will respond to. So they've actually done a functional MRI, showed the people commercials, and found out which one you'll respond to. When you see that pickup truck, and you ever notice pickup truck always seems to have this pretty, tall, gorgeous lady next to it, what has she got to do with the truck? She doesn't come with it. Okay? But the reason being is that when you see that, and it happens even in elderly, it doesn't matter how old you are, whenever we see a beautiful face, we get a little bit of dopamine. And that's, advertising has known about it forever. You think they're going to put somebody that's not up against that truck? I mean, think about it. Who do they put up against the truck? And who are they trying to attract? Okay, that reward circuitry of that male to try and buy that truck. She doesn't come with the truck, all right? And here's some of the areas that get affected by it. This is actually taken from an advertising company that was doing commercials of trying to find out what areas of the brain were stimulated and how they could get you guys to buy. Now, usually a commercial doesn't do anything like that to me. But they're going to get smarter about this, and next thing you know, we'll be buying. Here's the beer study. Remember I showed you the beer brain and the males had that? Same thing. This is the same in that reward circuitry part of the brain. This top one, there's dopamine being released when they had the taste of beer flavor. The second one is when they have a functional MRI with the taste of beer. And then the next two on the bottom are they just want a beer. Okay, but if you notice, that whole reward circuitry is there again that we have. And alcohol does the same thing to our brain. So what is the reward circuitry? The purpose of it is to make sure that we initiate and take food in was the purpose, and for reproduction. But unfortunately, sometimes if we don't have the right amount of dopamine and we're deficient in it, then we start to do different behaviors, and also receptors. We can have deficiency in receptors. So this dopamine can have a lot of influence on addictions, how people become addicted to things, what we do. They can become addicted to food as well, because they'll get a dopamine response from that as well. This is the brain on the left is taking in sugar. Okay, so we've got a response there. And then cocaine. So again, we're taking in dopamine and we're getting the same kind of response. And we're seeing the same kind of cycle that's happening. And you can understand why people get addicted to things. Teenage brains. All right, well, one of the things that I would have taught you probably years ago is that we thought the brain was done growing probably about age 3 or something like that, and maybe refining and developing. There's a Harvard scientist that just came out and said that your brain's still growing until you're 30, which is kind of amazing. But part of it that's growing is, again, this prefrontal area is still growing, and this is showing you how by age 20 we're finally got a full brain almost developed there. But think about the decision making that teenagers do. You know, I mean, they're not very good at it. They stink at it. My daughter was walking down the street with her friends. They're just walking down the street. They're not doing anything. And the police officer just pulls up and wants to know, why are you walking down the street? And somebody goes, run. They all ran. I was like, what are you running from? You weren't doing anything. You were just walking down the street. And they all ran and they dispersed, and now they call in extra support. And one of her friends is actually, the tree was this wide, and she's hiding behind it. And the cop has the big floodlight on her. I mean, these cops had to be laughing like crazy. And she's like, do you think they see me? I mean, no prefrontal lobe. I'm like, good God, girl. I mean, why'd you run? I was like, you know, we get this call from the police station. They'd gather them all up. And I go, why'd you run? They're like, I don't know. Somebody said run. I'm like, yeah, no prefrontal lobe. Like that. You get teenagers that make silly decisions like, let's race down the street and turn our lights off and see how fast we could go. You know what I'm saying? And that's the reason, you know, they make these decisions and you're just like, what were you thinking? Well, they weren't, because they have no prefrontal lobe. It's just not there. And as we get older, that prefrontal lobe develops and develops and develops. And just in the recent research I found out, this Harvard scientist is saying that we're still developing until we're 30, which is kind of amazing. You don't think of it in that terms. But it certainly explains teenagers and why they make parents get gray hair. Because they have no prefrontal lobe. The zone, this is a good one too. We did a study. You know how you ever have that where you're zoning? You're just like, you know what I'm talking about? Where you're not thinking of anything in particular? Well, what they found out that the male brain, when they zone and they're not thinking about anything in particular, does a little thing different than the female brain. When the female brain is zoning, and we're just kind of like staring off in space and we're not thinking of anything, we're still bouncing around in the cerebral cortex and going back to different areas. We're still planning the dinners. We're still planning on what we're going to make for next week or what we're going to do when we get home and stuff like that. Our brain really doesn't cool off as much, okay? The male brain, we got to work on this, girls. The male brain completely cools off, goes right to the limbic system where there's no language, so they're doing nothing but thinking about sex and grunting. Okay? They're in a very happy place. Okay? That's all they're doing. They're just cooled off, and this is why when they're like that, you could smack them. Okay? Because they're, you know where they're at. Because my husband goes, and I'm like, my poor husband, he's heard these talks before, and one of them, I talked about the beautiful face and dopamine. We were at an airport one time, and this girl comes right out of the store and comes right in front of us and is walking in front of us. Absolutely gorgeous woman. I mean, she's got these stilettos on, so she's probably about 6'2". She's got this little short little skirt dress on, and it's platinum hair that's like here with these sunglasses. I thought she looked like a movie star, but she's literally like right in front of us. Now, I told you, a beautiful face gives a little dopamine. So my husband's like this. Like that. And I'm like this. And I said to him, I go, are you getting any dopamine? Like that. And he's like, And this girl wouldn't go away. We kept walking, all right? And she's in these 3-inch stilettos and all this other stuff, and I just keep looking at him. And after a while, I see this little bead of sweat coming down his face, like that. And he's trying not to look, like that. Finally, she goes away, and I looked at my husband, and I go, do you believe that woman had stilettos on? Like that, and he goes, I go, oh, you're in your limbic system. You're not even where language is. Poor man, I torture him to death. That's where they go. They totally cool off. And we're still planning things. We're still planning dinners. We need to learn how to cool off, get in our limbic system, zone a little bit, maybe at least have one thought of sex a day, or something like that. But we don't. And I decided to end with a fun one. Look at what we're doing now. Dogs. I know, isn't that cool? They actually trained them, and they worked very hard to train them to work with signals, because an MRI can't take any movement. So, and how do you put a dog in there and then still give it signals and reward it and do things and not have it move? So they worked with all these dogs for a long period of time to get them to lay in an MRI machine and not move, but yet we needed their brain to respond, which is kind of crazy. And they did. And what we found out is that they are very much recognizing our facial expressions. And we probably already knew that, because you can, I don't know about your dogs, I can go home and they're like, yep. What do they do? Or somebody's done something and they give it away. All right, who messed in the house? And they're like, backing up, all that stuff, like that. So, it's like, as we say, they're carrying the smoking gun. Like, who did it? And the one, always gives himself away. But we also think that their area of brain that's stimulated is very similar to love. So we think they recognize love. And we're doing more and more studies. The interesting thing about it is emotionally, it seems like they're responding like humans. They don't have the cerebral cortex to be thinking like us, but they seem to respond. And it's really kind of neat. And it's amazing that we've been able to do it with dogs, that they could train them like that. Aren't they cute? There were 7 of them that they've been studying. Wow. I've got images, too, of them. They have them, that head coil I told you that they actually put the head coil on them. So they actually got the dogs to put their heads in this head coil so we could get all that imaging of them. Crazy, isn't it? So where are we going? One of the things about the male and female brain that we realize is just where one's weak, the other one's strong. But go back to caveman, he was meant to be the hunter, we were meant to be the gatherer and gather things up, and the brain really hasn't changed a whole lot. Any questions? Fascinating stuff.
So you say the brain doesn't stop growing until you're 30. If people have been through traumas, does it have an effect on the growth at that point?
Actually, one of the things that's interesting about trauma, we now realize that the female brain is much more susceptible to it and has a tendency to take and have long-term consequences more than a male brain. And the trauma, which is this traumatic brain injuries that we're coming out with, lots of studies have gone into it. We used to think when people got concussions that it was just a short-term thing. We now are realizing that it's much longer than that. We're thinking that sometimes it's causing Parkinson's and a lot of long-term consequences due to the trauma of the brain. Interesting study that they did too with a group of nuns. These nuns, they couldn't figure out why they were living so long. They were 104, 93, still teaching. The 93-year-old at this seminary was actually taking a computer class because she had to teach computer at the school she was at. So they went and studied them, and they thought it was their food. They did this, they did that. And no, what they found out is at night they don't watch television. They played strategic board games. And as a result, they stayed active and lived longer and had no dementia and things like that. So the brain is one of those things, if you don't use it, you're going to lose it. So, and one of the worst things that senior citizens do is they get into routines. You got to get out of it. You got to get them trying new tastes, new places, new things. Get out of the routine, because that routine, you want to keep growing all those synapses. You want to keep growing all those new connections in your brain. The latest way is also to study connectivity of it, which is what the University of Pennsylvania is doing. And we found out that the male brain has a tendency to connect more front to back, and the female from side to side. So lots of stuff still out there. Excellent. Excellent for you. Yeah, they're all good for you. Anything that's stimulating your brain, anything that's new, you're creating new synapses, new things.
The Knowledge Exchange is a presentation of Lakeland Community College.